Gotta make another couple $100,000 a month. No, I can do it, I just gotta stay in the hunt. Grab some snacks and some fluids and a couple hands.
Welcome back to the Entreprenudist Podcast. I'm your host, Randolph Love III, chartered financial consultant, business owner, and certified life coach. That's right, certified life coach. If you would like to schedule a free consultation, just look at the show notes. It'll show you how you can reach out to me. A lot of people, only thing that you need at this point in your development is somebody to actively listen to you and ask you the right intuitive questions in order to get the breakthroughs that you need. On the show today, I have chiropractor Dr. Percell Sanders, located in Jacksonville, Florida. Dr. Percell Sanders is not just a chiropractor. He's my family. And he's not just my family. He's in my immediate family. And he's not just in my immediate family. He's my cousin. And he's not just my cousin. He's one of my first cousins. What does that mean? That means his mama and my mama's sisters. What does that mean? That means if our DNA profiles were any closer, we would probably be in violation of the COVID-19 social distancing guidelines. With that being said, I bring to you my interview with Dr. Percell Sanders, chiropractor. Dr. Percell Sanders, thank you for coming on the show.
Thank you. Thank you for having me.
Absolutely. Can you introduce yourself and what you do to my audience?
So my name is Dr. Percell Sanders. I am a chiropractic physician, primarily working out of Jacksonville, Florida. I work out of two offices, one on the north side, and then the other one in Arlington. And I mean, I work primarily with patients who are in car accidents, slip and falls, things like that. People who come in with generalized neck pain, back pain, headaches, with from all ages, from as young as 8 years old to as old as 100. So anybody can really see me.
And I like what you just did there, because when you mentioned what you do, you mentioned what people typically think of chiropractors in relation to, which is a car accident. And then you just mentioned something that I don't think most people connect the dots on, which is you just so used to having headaches and you think that's a normal part of life, and you take medication to hide the symptoms of that pain. But really and truly, you could start seeing a chiropractor and never have to deal with headaches again.
Absolutely. I mean, the main thing about it is because the anatomy and how the anatomy is made up in the human body, there's arteries and nerves that flow through the cervical spine or the neck in a certain individual, and typically what happens is in my profession, in the chiropractic profession, we describe it as a subluxation. And what a subluxation is, basically, in simple terms, it's basically a misalignment in the spine. All right. And so when there's a misalignment in the spine, this can, of course, cause interference, which can cause different symptoms, such as, which would include headaches, neck pain, or any type of, traveling or radiating pain like numbness and tingling and things that people would typically get. So my job, of course, is to go in and we correct that situation.
And just to make an analogy for it, and let me know if you agree with this analogy. Back in the day, all computers were hardwired, connected.
Right.
And it came from the wall, then it went into the system, the dial-up system, and then it went to the monitor and all of that, right? And when you had a problem with your computer, you would first check the cords to make sure all of the cords were connected. The way I like to describe it to people when I talk about chiropractors, and the main reason I know about chiropractors is because of you, and we're going to get into that. But when I talk about chiropractors, I describe to them that, all right, your brain is the control center. How is it controlling your finger? How is it controlling your leg? How is it controlling your toe? How is it controlling? And then, all right, so let's follow this path. Oh, it's controlling it through your spine. Okay, so that means that if it's not getting out the spine, it ain't doing what it needs to do, and vice versa. If it's being blocked, then that could be pushing that energy back and causing a headache. Do you agree with that? Do you have any success stories of people that maybe had chronic headaches and all of a sudden seeing you change their life forever?
Absolutely, and that's a good analogy. The brain is the like the primary, control center in the body. And so the control center has to send signals out, like messages out to different areas of the body, through the nervous system or the spinal cord, as we would like to put it. And if there's a disconnect anywhere in that pathway, then you have what we call dis-ease. But of course, I had a patient, I can remember one in particular. This was a 20-year-old young lady, and she had chronic migraines for years. From what she told me, she was having them, since she was about 9 years old. And they would constantly come up, every day, every other day. She said there was never a week that went by where she didn't have a headache. She came to me, of course, she shared with me that information, and within a week and a half of me treating her, when she came back to me 2 weeks later, she shared with me, she said, "Hey, Dr. Sanders, I just want to tell you, this has been the first time in over 10 years that I haven't had a headache in 2 weeks straight." So it just goes to show you that, we definitely, make a lot of changes in the nervous system of the body, especially when it comes to headaches, migraines, and things of that nature. You
changed her life forever.
Oh yeah. And she's a faithful client. She's a faithful patient. She doesn't come every week, of course. She comes like maybe once every month or once every couple months, but on an as needed basis. So, but she definitely, now she swears by it, she tells her friends, and we've gotten people that come because of her, and they've had similar, stories.
Now, you mentioned the amount of time she visits you. Now, in your experience, what's the difference between the people who only come when there's an issue and the people who create a regular routine with you, a regular schedule that visits you? What would you say is the difference that you've noticed from those people?
So there's two types of people who comes. All right, there's people who come for what we call wellness or maintenance care, and then you have people who come for acute care. The difference between the two, when I say people who come for acute care, these are people, mainly my patients who come in who have been in a car accident or some type of traumatic injury. So they come on a more frequent basis. And then I have people who they may have been in an accident maybe 5 or 6 years ago or so, and they're not in pain per se, but they understand the benefit of chiropractic, which is relieving the nervous system of any interference, and just basically just well maintaining their body. All right. And then of course it goes, so I can go so much deeper, but then we'll be talking forever. But, the basis, of course, for the maintenance patients is they come occasionally, maybe once every 2 weeks, maybe once a month, either when they're feeling pain or just generally to have a regular checkup. It's the same thing as if you were going to a dentist. Okay, you go to the dentist occasionally to get a cleaning, okay, for your teeth. It's the same thing with the chiropractic. You go to get maintenance on your spine, all right? It's almost like a spine cleaning, all right? We're not literally going to your back and cleaning your spine, but it's the same concept.
And I heard you mention we'll be talking forever. Just so you know, for some ungodly reason, the reason why podcasts are so popular is apparently people like to listen to people talk forever. So don't never let that be the reason to stop you from going in more detail. Because, hey, if that wasn't true, if people didn't like to listen to people talk forever, podcasts wouldn't exist and we wouldn't be here. Hey, all right, so you have a client that you fix their headache.
Mm-hmm.
They stop coming to you, and then they come back when they have a headache again.
Mm-hmm.
And then they stop coming, and then they come back when they have a headache again. And then you have the client that comes regularly and just maintains that well-being.
Right.
Does it matter to you which type of client it is? Or would you tell that person who only comes when there's a problem, hey, all right, hey, do it that way. It's all good. Or would you say it's better to get a regular schedule? Or which side are you on? Does it not matter or does it matter?
It definitely matters. So I always like to describe it this way, put it this way with patients. If they are someone who cares about their well-being, their health, right? I always put it this way. I say, I usually ask them, how often do you go to the dentist? And most people, they'll tell me, they'll say, well, I may go, every 6 months. And I ask them why. I say, well, why do you go every 6 months? They say, because I want to get a cleaning. I want to make sure everything's straight with my teeth and everything's good. I say, okay, and then of course, in between time, what do you do? Say I brush, I floss, and things like that. I say, okay, so take chiropractic and use it in that same concept. All right, you want to maintain your spine, right? One of the biggest reasons why people don't really think about it is because your spine sits in your back, out of sight, out of mind. All right, but I want to get people out of that mindset. Okay. I want people to think of their spine as one of the most important things in their body, because your spine protects your spinal cord, right? Which, of course, your spinal cord, as we said earlier, is that connection between your brain and the rest of your body, all right? So without your spine, okay, we will be quadriplegic, people who just can't move, all right? When there's an injury to your spine, obviously, there's a myriad of things, or symptoms that can occur. So I tell patients, I say, hey, just like you go to your dentist every 6 months, or on certain occasions throughout the year, you should do the same thing when it comes to your spine to make sure that everything is functioning like it should, to make sure there's nothing going on. All right. Or like you would go, and get a yearly checkup or whatever. Okay, it's the same concept. So once I kind of explain that to them in detail, then most people are kind of on board and they understand and they get the benefit of why they should get treatment, why they should get adjusted and things like that.
Okay. A person has just been in an accident. They have an option of seeing a medical doctor and a chiropractic doctor. In your opinion, is there a difference?
There's a difference, but it's good to do both. All right, and I say it's good to do both. See, where I work at North Florida Medical Center here in Jacksonville, Florida. We're a multi-disciplinary office. So what that means basically is we have a number of different specialties in our office because we believe in taking care of the patient and making sure we do everything that's necessary for the patient to become better. All right. So we have a medical doctor on staff. We have myself, a chiropractic physician. I have a physical therapist on staff, as well as a massage therapist also. Okay. So we all sort of work together so the patient can, get better, if that makes sense. And essentially, they'll see the medical doctor. If they need a prescription or a painkiller or a muscle relaxer, then they can get that. But our goal isn't to keep them on the medicine. Our goal is to kind of not have them on the medicine. The reason why we give it to them, because of course, when a person is in acute pain, all right, the muscle relaxer or the pain medicine, it kind of helps them get through their days when they're working and things like that. But in the meantime, while they're taking that medicine, they still come in for treatment so they can get better. Okay. And that's where the car accidents and things kind of are a little different from the wellness cases.
Is there a difference between somebody coming to your facilities where you have the medical professional, the chiropractic professional, the physical therapist practitioner, the massage practitioner? Is there a difference between having everybody under one roof than a person having all of those people but with different facilities? Is there a difference?
Me personally, I feel like there's definitely a difference, and I feel like it's beneficial to have a multidisciplinary office because it's everything under one roof. Okay, you're getting, it's like a one-stop shop essentially. All right, rather than having to go here for a massage or go here for physical therapy or go here for chiropractic or go here to see, a primary physician, you got everything in one place. All right, and not only that, but because we all are under the same mindset, all right, and same belief, we all work together. Okay, so what I do, I can, pass off information to the physical therapist, give them some insight, which will in turn help them tailor their plan, and what kind of exercise regimen that the patient should be on. If I have an athlete that may come in, it's perfect for the physical therapist to know certain things so that physical therapist can kind of tailor that athlete's exercise regimen, to get them back to doing, whatever workout or whatever sports that they're used to doing on a day-to-day basis.
I also heard something else, that Florida is one of the few states where chiropractors also do physical, because I heard you mention athletes, but Florida is one of the few states where chiropractors also do physicals for student athletes. Is that something that your office does or no?
Currently, that's not something that our office does, but we are talking about adding that aspect to it.
Okay. Got it. So what's another thing that people typically struggle with, that they don't normally associate with, my chiropractor can fix this? Can you think of other things that come to mind?
So one thing that I think people probably don't realize is that chiropractic, we work with extremities as well. All right. Usually when people think chiropractic, they mainly think neck pain, back pain, headaches. But we also work with a lot of extremities also. I couldn't tell you how many patients I get come in and they have shoulder pain, elbow or wrist, hip pain, knee, ankles, generalized pain. People who may come in and they suffer from, hip dysplasia or arthritis, different, things like of that nature. So we work with a myriad of different symptoms, and there's different types of chiropractors too. I'm only one type of chiropractor, but there's also pediatric chiropractic out there. There's chiropractors who specifically work with children. That's all they work with, children from newborns up until 12 years old. And then you have chiropractors out there who work specifically with athletes. That's all they work with. They work with, football players, basketball players, track athletes, high jump, all of that. I have a friend of mine, actually, and my colleague also, he works with entertainers. So he mainly goes into studios and he works with artists and things of that nature. So there's a myriad of different types of chiropractors that people don't realize. They're like, well, dang, I didn't know y'all do all that. I didn't know a chiropractor can come visit me at my house. We do traveling chiropractic also. So there's a lot of things, that chiropractors can do that people don't realize they can do.
Yeah, you mentioned your colleague, the one that works specifically for entertainers. That is something that I think most people don't know. When you are in alignment, typically you're more creative.
Right.
And a lot of people don't know that a lot of their favorite entertainers, singers, actors, hosts, they have chiropractors.
Mm-hmm. Yeah, absolutely. I mean, and it's so fun. Like, I think, for instance, Michael Jordan. Michael Jordan, he swears by chiropractic. Arnold Schwarzenegger, he actually just was at a chiropractic conference, saying how chiropractic sort of helped him, not only in his athletic abilities, but while he was governor of the state of California, and while he was acting and things of that nature. So chiropractic is definitely good when it comes to just thought processes and just being creative from a creative standpoint.
Yeah, because and can you do me a favor? Okay, it's good. We good. I was getting some feedback from your side, but one thing that I heard that surprised me was a lot of people hold their trauma in their posture. They don't even realize it. And they go through life thinking people just don't smile at them, but really and truly it's because your posture is somebody that's not open up to being smiled at. I have heard of people going to chiropractors, changing their posture, and all of a sudden people are smiling at them on a regular basis. And when people are smiling at you on a regular basis, it just can't help but change your attitude and your outlook towards life. Have you ever had a patient that came in and they probably looked kind of like low self-esteem based off their posture, and after a few seconds, they're probably one of the most popular people in the office, a few sessions. So how does that feel when you change people like that?
Absolutely, man. Matter of fact, I had a patient like that just this morning. She came in and I went over her x-rays with her, and, she had a certain demeanor about herself, where she didn't smile a lot. She didn't really smile at all, really. But after I kind of explained, I went over her x-rays with her, and I kind of showed her why her spine looked the way it did, due to her posture. And we worked on her posture and how she could correct that. After the adjustment, after the conversation, when I say she was a different person from when she came in to when she left out, it was almost night and day. So to me, it does wonders. That's what I got into this field for, to change lives in that manner, so just going back to what we were talking about earlier in the beginning of the conversation with the young lady and the migraines, the chronic migraines that she was having. Those are the things that really give me joy, when I'm working with patients, I had another patient yesterday, an older gentleman. He was about 78 years old. And, he came in with surgeries in his neck. He had a surgery in his low back. And, just after 2 or 3 treatments, he's already seeing the difference. So to be able to make those differences and people as old as my grandparents, it really makes me feel good, and make me feel like I'm doing something worthwhile.
So let's talk about what people are used to seeing online whenever they see hashtag chiropractor. What they be waiting on from as soon as they hit play. The client is laying on their back. They're looking nervous. The chiropractor is behind the client, setting up the shot. And then the money shot comes. The chiropractor money shot. They crack the neck. They pop the neck. Or we call it crack, pop. What is the chiropractor terms for what y'all do, and why do y'all do that? So
the cracking noise, quote unquote cracking, we hate to use the term crack. All right. And I always tell patients that come into my office, I say, now that you're in here, now that you're a patient, we're gonna expel the terminology crack out of your vocabulary, and we're gonna add in adjustment, because it's really the adjustment that's happening. All right. What you're hearing is what we call an audible. It's an audible cavitation. That's the terminology, the medical terminology for it. An audible cavitation. And basically what it is the joints in your spine, whether it's in your neck or your back, there's joints that have joint capsules. And because there's gas that fills in those joint capsules, when the gas is released, it makes a audible sound. All right. And that's the quote unquote crack that most people hear and get relief from when that adjustment happens. When it's someone's first time getting an adjustment, they're typically always nervous at first because, who wants their neck snapped, right? We watch so many movies and TV shows, and we see what happens when somebody, snaps someone's neck and then they drop dead, right? And I tell people, I say, if all you watch is TV shows and that's all you got from that, then let me educate you a little bit, okay? It really takes a lot of force to snap someone's neck, thus killing them, right? What we do, and this is why I tell people all the time, don't try to do this to yourself. All right, don't try this at home. If you absolutely feel like you need to quote unquote crack your neck, all right, go to a board certified chiropractic physician and have them do it for you. Okay. So yeah, it's the audible is the sound that most people hear. But once someone gets their first adjustment, 9.9999 times out of 10, they love it, they enjoy it, and they always come back for more.
Why do you think social media likes seeing that shot so much?
I think it's just because, honestly, I feel like people like to see it because it's something that they're not used to. And to see someone else get it and to see the reaction that they get from it, when most people see it who've never done it before, they're always intrigued by it. I've had patients who they've seen chiropractic before, they've seen it in the videos, but they never actually go. And the sad part is not a lot, but maybe half the patients that I see, their first time going to a chiropractor is due to a result of them being in an accident, a car accident, but once they get into the office and I ask them, I say, have you ever been to a chiropractor before? Their response is usually, no, I always watch it on the videos. I always see the stuff on the videos, but I was always scared because, I thought they probably was going to break my neck. Right. And I proceed to ask them, well, why is it that you feel that way? Because I don't feel like your neck should make that kind of noise. I'll say majority of people, especially young people, when they're going about their days, we tend to crack our knuckles, right? So just to debunk this myth, cracking your knuckles does not cause arthritis, all right? I'll say it again, cracking your knuckles does not cause arthritis. There's been studies that prove that it does not cause arthritis. So you can crack your knuckles all you want. You'll be fine. That's just a disclaimer. But like I say, the important part is you can't feel as though just because of what you watch on a video, that's what you're necessarily going to get when you go into an office. Okay. So that's really the important part in that.
You know why I think they like to watch it?
Why is that?
I think they think that at one time, a chiropractor just going, and they just go, the person just is going to roll over dead. I think it's like the same reason that people watch high speed, watch NASCAR and all of that. Everybody say, I like this. I like to see the cars go fast. Nah, you thinking like, they might crash. and when you see somebody getting their neck adjusted or that audible pop, you think, it might not work out this time. Because but I definitely see how that might keep somebody from like wanting to go, especially if they see that, all right, this is the standard of me going to see a chiropractor, is I'm going to be putting my life on the line. But like you said, it takes a lot of force, and I see that y'all do something before y'all crack the neck. Y'all place your hands around the bottom of the head, and then you move it around a little bit. And then as soon as it seems like you unlock a code, and then you pop. What are y'all feeling for when you do that, when you shake the head like that?
So in a lot of cases, in many cases, I should say, we are feeling for any type of restriction. It's what we call palpation. Okay, so palpation is, in the chiropractic world, it's our way of really feeling for any type of, imbalance in the muscles, all right, of the patient. And we palpate from the base of the skull all the way down to, the lower part of the back. All right. And it really allows us to gauge, how well the patient is moving, when we're doing a palpation, a motion palpation, which we move the head around and kind of see how well the movement is, or a static palpation where we're sort of pressing and feeling for, whether or not there's any tenderness or whether or not there's any type of muscle imbalances that may be going on. All right. We do all of these things within seconds before we adjust. And that's how much training that goes into it, when you're in school, because it allows us to sensitize our hands and our fingers to, the body, and how well it's doing. So there's a lot of stuff going on within those few seconds before the adjustment that people don't realize is going on.
And you mentioned all of that training. Now, I know one part of y'all training is actually putting hands on patients, clients, while you're in school. Like once you reach the later part of your school.
Right.
How was all of that for you?
It was interesting. So we definitely do a lot of hands-on training. It's very equivalent to medical school. People always try to compare the two. Both are really equivalent. We do so many hours of anatomy and physiology, so many hours of, microbiology, so many hours of chemistry, biochemistry, osteology. We do a lot of hours of these things, and then a lot of hours of hands-on training also, which the practice makes perfect, obviously, right? and of course, when you're first starting out practicing, you're usually practicing on your peers, the people that are in school with you, your classmates. And then you kind of graduate into practicing with local community or people like family or close friends who may trust you, to work on them. And then once you kind of get so many hours of practice and so many hours of training, it's almost like I'm ready for the real world. I'm ready to adjust someone who I don't know whatsoever. And I can articulate, what's going on with them and how I can better treat or better manage their symptoms and their issues.
And speaking of practicing on family members that trust you, at one point while you were in school, what I was coming once a week, twice a week, some weeks?
Oh yeah. You were coming twice a week, once a week. I think we had you on once a week maybe.
Man, we was on the get you out of school program.
Yeah, pretty much.
How many adjustments you need? All right.
I said, hey, cuz, I need about 10 more adjustments to close out this here case. So I need you to come in, maybe twice a week for the next few weeks.
Yeah. Yeah.
But it all worked out, man. Like I said, for me, especially going through school, it's mainly about just you kind of the people that invest in you, I should say. And that right there alone is an investment in and of itself. With family kind of stepping in and like you did with me, stepping in and allowing me to kind of practice and things like that. It was a win-win. I benefited from the practice, you benefited from the adjustment. You feel me?
Absolutely. And the reason why I brought it up was I had a chronic shoulder pain. And wasn't even a constant pain. It was just periodically, my muscle would just tighten up. It would just squeeze. And when it happened, no matter what I was doing, I had to just wait it out. And it was probably like maybe about 10 to 15 seconds at a time. But when your muscle is cramping up on you in your back shoulder blade, that 10 to 15 seconds feels like a long time. And I had been dealing with it for so long that I thought it was that's just all right. That's what I deal with. Every once in a while, at least once a week, multiple times a week, but at least once a week, every once in a while, my shoulder would just lock up on me. And no matter what I'm doing, I gotta stop. And just imagine if I was making a crucial decision driving and my arm would have lock up on me. It's happened like that while I was driving before, but it wasn't, I'm just driving along.
Right.
After going to see you, which I had never been to a chiropractor before, I didn't realize until later that it was gone. Something that I dealt with on a weekly basis went to never happening at all.
Right. It was a wonderful thing, man. It was a wonderful thing.
So that's like
I'm like, hey man, you back all right? Man, it's the best we've done felt in years.
Yeah, I don't talk like that, cuz. Hey, but tell me this. Because now, and here's the thing, the reason why that's like a boomerang, right? Because I went to you with no intention of getting any type of benefit, only from, helping you out. But I'm thinking, all right, yeah, I get my back cracked. And then it just came back to me. So does that happen? Do you have it to where people come to you for one thing and then something else happens and then they say, I just not noticed that this doesn't happen anymore either? Have you ever had that?
All the time, man. That's something that happens a lot more frequent than not. People may come in for one particular issue, and all of a sudden it'll kind of clear up another issue. Case in point, because when we talk about chiropractic, and this is one of the educational pieces that I use with so many patients, is chiropractic is all about addressing the cause, not necessarily the symptom. Okay, so and the difference between the two is when we talk about the cause versus the symptom. A symptom is something as a result of, right? You have numbness or tingling that may be going on in your hands or your fingers or your arm, right? But the cause of that is coming from your neck area, from a compression on, say, a nerve, right? That supplies the arm, the hand, or the finger, right? So many people may go to their primary care physician, right? And I'm not saying there's nothing wrong with, going to your primary care. Of course, I have a primary care. But they may go to a doctor and they may prescribe them something, a medication. And when they prescribe that medication, all the medication is doing is masking the symptom, but it's not necessarily correcting the cause, right? When people come to chiropractors, our goal is to correct the cause, which will, in essence, fix whatever symptoms may be resulting from that cause. So if someone comes in to me and they're having generalized neck pain, or they may be getting numbness and tingling in their arm, hands, or fingers or something, I look for the cause, I adjust the cause, and say they were having, chronic recurrent, sinus issues, right? I adjust their neck, and to them, of course, it's a miracle, because they're like, well, I was coming for neck pain and the numbness and tingling in my hand, but shucks, I can breathe better now, right? It's like my sinuses cleared out. So it just goes to show you that's just an example of correcting the cause can fix multiple different symptoms that may be happening in the body.
And I guess I would compare that to somebody who has a slow leak in their tire.
Right.
Yeah,
right.
You can continue to drive around and once every week or every few days pull up to the Pep Boys to get some free air, or even worse, you pulling up to the gas station and paying $1.50 a pop to keep filling your tire up instead of just plugging the hole or getting a new tire. The air leaking out and you having to always stop multiple times a week to fill it up, or once a week to fill it up. Even if it's once a month, that's still an inconvenience. Instead of you fixing the symptom of the air coming out and you having to stop, you fix the cause, which is plugging the hole or replacing the tire. Would you agree that's similar to what you're saying?
Oh, absolutely. Absolutely. You always want to correct the cause. The cause is, when you correct the cause, you can take care of whatever the symptom is. Right? There's the way Western medicine, has sort of evolved over the years, is we want to Band-Aid everything, right? And by Band-Aid everything, I mean we want to take a pill and mask the symptom, right? And I know people probably listen to this, they're like, well, didn't you just say you work in the office and y'all give pills and pain medicine? I did say that, but here's the difference. When we give it, it's not something that should be taken forever. We give it for temporary relief while they're still being treated. So to where eventually, while we're treating the cause, where eventually they won't have to take it anymore, right? They're not going to have to take the muscle relaxers or the pain medicine or anything like that anymore, because we're trying to address the cause. The purpose of, prescribing them, when my colleagues, my MD colleagues are prescribing them medication, is so it can get them through the next couple of weeks while they're working. Because believe it or not, we still got to work. We still have to, make a living, right? And no one likes to be in pain. Okay. So that's the difference. and why I say, yeah, my office does prescribe certain things, but it's not intended for it to be a long-term solution.
Mm-hmm. And I think I have something that in my life that's similar to everything you just said, to how you mentioned that you come for one thing and you end up fixing another thing. And when you came, you ended up, and the reason why you fixed what you came for and another thing is because you fixed a cause, which was causing both of those adverse symptoms. In my life, I just checked my status, and my passport should be arriving within the next few days.
Oh, that's awesome, man.
Now, keep in mind, I'm in my mid-30s. Keep in mind, I've been talking about seeing certain places that could have only experienced via TV and magazines for literally decades. Yet, I didn't have the first step it took to see those exotic locations outside of the United States.
Right.
Why is that? That somebody might say, okay, you talk about what you want to do, but you don't have the first step. Do you really want to do it? Right. And it's because of a limiting belief that needs to be addressed. And when you address one limiting belief, it fixes what you wanted it to fix, but it also fixes other things. And that's why people come to see me as a life coach. I talk to them. I don't address it. I let them address it. And when I say that it's rare that people get asked questions by somebody that they trust that's very intuitive. Usually people only get asked questions by people that they grew up with. And unfortunately, whenever you know somebody that close, you can't help but always consider them a hypocrite. You know what I mean? Because you can only think about where they've been instead of where they're going.
Absolutely.
What I like what you're doing is you see where they've been. You see them come in with that self-defeating posture. You see them coming in with that not receiving smiles, and the limiting belief that they tell themselves is that nobody likes them. But then you fix their posture. Right. You open up some things. They were used to breathing hard. Now all of a sudden they haven't even realized it yet. They're 2 months into their chiropractic visits, but they haven't even realized that their sinuses are clear. They're not going to really realize that until next month, right? But right. But people are smiling at them, and they're smiling back. And because their sinuses are clear, finally they're getting on that bike that they bought 2 years ago that they didn't get on. Not realizing the reason why they weren't getting on that bike was because they couldn't breathe. And not realizing they couldn't breathe because they didn't go to the chiropractor.
It's a cascade effect.
Absolutely. So does a person have to have a bachelor's degree to go to chiropractic school?
It depends. Because of how different states make up their own laws. In the state of Florida, yes. In the state of Florida, yes. In the state of Georgia, no. However, you still need the proper prerequisites to enter the school. And when I say prerequisites, the prerequisites, it's funny, are almost what it takes to get a bachelor's. So gotcha. it behooves an individual to go ahead and get the bachelor's, so that they can go ahead and, because they never know, most people, I should say, they typically don't know exactly where they want to practice. And there's certain states that require a bachelor's, whereas there's others, such as Georgia, which don't. So if there was someone who may go to school and they don't know if they'll practice in Florida or Georgia, it will make more sense to go ahead and have the bachelor's, because if they do decide to practice in Florida, it's required that you have a bachelor's to practice in Florida.
Can you think of some of the Georgia prerequisites, since that is one of the states to where even if it might, it's almost the same as getting a bachelor's, somebody might be trying to eliminate a barrier to entry by just taking care of the requirements. Can you think of some of the prerequisites prior to enrolling?
Mainly those basic science courses, your chemistries 1, 2, physics, your microbiology, your biologies 1 and 2 and 3, and your anatomy and physiologies. Just to name a few, especially those basic science courses are definitely necessary with what you need. And in most cases, someone who goes and get their bachelor's degree in, say, health sciences or biology or something, they're going to have all of those classes anyway. So you can go and, try to knock out all those prerequisites. But I mean, it's so much more beneficial to just go ahead and get your bachelor's degree, unless without a shadow of a doubt, chiropractic is exactly what you want to do, and you want to practice only in Georgia or whatever state that doesn't require a bachelor's, then by all means, this isn't to deter anyone from pursuing that.
What was your bachelor's degree in?
My bachelor's degree was in health science.
Got it. And with health science, you pretty much had all of the prerequisites done. So as soon as you got to, what school did you go to?
I graduated from the University of North Florida.
And as far as chiropractic, what?
As far as chiropractic, I went to Life University in Marietta, Georgia.
So by the time you got to Life University, you already had your prerequisites based off your bachelor's, what you chose
Absolutely.
to get. How many people do you see come in with a bachelor's in business management? I think that's one of the most popular bachelors. How many people do you see come in with that? And is their road a lot harder than yours if both of you started on the same day at Life University?
I'm glad you asked that question. I actually have a buddy of mine who's also a colleague. He practices in Ohio. I believe Dayton, Ohio. He is actually a regional office, manager at one of the offices, health offices up there. And his background was in business management. His bachelor's was in business management. When he came in, and we started at the same time, when he came in, he had very little, science background. So the chemistries and all of those things, of course, he had to take those classes, because those were prerequisites. And because he didn't have those prerequisites in his bachelor's, he had to take those prerequisites extra. But the thing about him was he was the type of person where he had to do a little bit extra every class because he didn't have the basic knowledge with certain classes. When it came to anatomy and physiology or chemistry and things like that, he didn't have that background. So with him, he worked really hard. I mean, this man was in the library probably an extra couple of hours or so when some of us would leave, and he would do very well on exams. And I think he graduated cum laude or magna cum laude, one of those laudes.
One of them lottie-dotties.
Right. But it just goes to show you, it doesn't matter what background you have. It doesn't matter, whether you're coming from a business background or a construction background. It doesn't matter. If that's something that you really want to do and you have a passion for, then you'll make it happen like he did. And sure enough, he used not only, him graduating from chiropractic school, but he used his business degree to sort of propel him into what he's doing now, which for the clinic, he's essentially, managing, multiple clinics. So he's using that background for that purpose.
And you mentioned both of y'all started at the same time. Did y'all finish at the same time?
Yeah, I believe he graduated a quarter before me. So
see, look at that. Okay,
yeah.
So all right, so if I'm hearing this correctly, because now we don't have no theory, we have something that actually happened.
No, I take that back. I stand correct. We graduated at the exact same time.
Okay.
Yeah, we graduated at the exact same time.
So even though he did not have the prerequisites initially, because he had that bachelor's and that determination, because it sounds like what you were saying was he was doing a little bit more than you, he still was able to finish, even though he did not, his bachelor's wasn't in health science or any of those physical sciences.
Exactly.
Got it. That's good. That's good. So when did you first realize you wanted to be a chiropractor?
Man, probably my junior year in undergrad, my junior going into my senior year in undergrad. And it was really kind of on a whim. And when I say on a whim, I wasn't really looking for it. I wasn't looking at it because I was actually going to go to physical therapy school. I was going to go be a PT, physical therapist. And I had a guy actually approach me while I was on campus at UNF, and he asked me about it, if that would be something that I would be interested in. And I said, nah, not really. I'm doing physical therapy. And so his question to me is, are you sure? And usually when somebody asks you that, you're just like, all right, man, look, I already told you. And you kind of keep walking. But when he asked me if I was sure, he said, well, look, I just want to show you something. He said, I'm not going to take up much of your time. And he said, just give me 5 minutes of your time and then tell me what you think after that. So, of course, he pulled me to the side and he kind of showed me. And I knew about chiropractic, but I wasn't really all that well versed. So he kind of gave me a very broad overview of what chiropractic was and what they do. And I said, okay, well, it seemed, of course, to me at the time, I was like, it seemed somewhat similar to physical therapy. All right, well. So he piqued my interest. He told me to come to a talk that the president was coming to Jacksonville. I went to the talk. The president, those people who they can sell anything. And when they talk to you, if it's a penny, they can probably sell you a penny for $20.
Mm-hmm.
That's how well spoken they are. This is how well spoken this president was. His name was Guy Reekman. His name is Dr. Guy Reekman. He's actually the chancellor now at Life University. But he spoke and he sort of kind of broke down what chiropractic was and what it means, to the body and what it can do for people. And the philosophy of what chiropractic is. And after he spoke, I was sort of taken aback, and I was like, well, I really thought I wanted to do physical therapy, but shucks, I think I want to do chiropractic now. But of course, I said, well, I'm gonna do a little bit more research. So I did. Long story short, I did a lot more research. At the time, I was going into my internship in undergrad and what I was going to do. So I did my internship at Brooks Rehabilitation Hospital here in Jacksonville. At the time, I was working at Brooks and doing my internship at Brooks Rehab. I met a guy by the name of Dr. Royce McGowan here in Jacksonville, Florida. And I met him through family connections. I started shadowing him while I was doing my internship at Brooks Rehab. For me, but in that time period, it was about a 6 to 8 month time period between the shadowing his office, asking him questions, kind of picking his brain, Dr. McGowan, who's a chiropractic physician, and doing my internship at Brooks Rehab. to me, it was night and day. I kind of made my decision from those two experiences and knew that I didn't quite want to do physical therapy anymore. It was chiropractic that was sort of something that I wanted to get into. So after that, I mean, the rest is history. You know, I applied, got accepted, and went from there. Here I am.
Throughout this process, can you think of a time where you didn't meet expectations? It would be considered you failed, and how you overcame that?
Oh man, failure. Shucks, man, I could write a book about that. Throughout the school process, I should say, you know, and I think this is just anything that you go through in life, you know, you have bumps in the road, you know, and of course, while you're in school, and I think any medical student or any professional school student will know that you go through school and there's a lot of stress, you know, and I had my fair share of failures, I should say, while I was going through school. And really, I think ultimately what it really taught me is never to give up. You know, as cliche as that may sound, it's still true to the core, you know, because many times some people fail and then they sort of quit, you know, or they fail twice and they sort of give up. Right. And I failed more than on a couple of occasions, you know, and I could have easily said, you know what, I'm just going to go back. I'm going to go back home. I'm going to do something else and I'm going to go from there. But I never really, you know, I never had that mindset. You know, I never had that mindset to say, okay, well, I failed this and I'm going to stop. You know, one thing in particular, microbiology for me was my Achilles heel in school. Microbiology whooped my butt up and down. You know, I just could not get it. It's like I studied for hours and hours and hours on end. And when it came to testing, I just could not get it. You know, I failed microbiology 3, passed microbiology 1, passed microbiology 2, failed microbiology 3, had to retake it. Then when it came to boards, so chiropractic, there's 4 boards. And when it came to taking my boards, the very first board, there was microbiology. The entire test, 90 questions, microbiology. And of course, right, because that was the one subject that I struggled with, that's the one subject that I failed. So I took it again, failed it again. Took it again, failed it again. Right? So that was 3 times. I took microbiology 3 times and I failed it 3 times. And of course, I think anybody would say, well, shucks, give up. Shucks, you tried, and you tried. So just go ahead and give up. But for me, I knew it was not only a determination, but it was really in my mindset, hey, this is what I came here for. I'm going to get through this. A lot of prayer, a lot of extra studying, you know, a lot of motivation from family and friends, you know, and the 4th time that I took it, of course, was the charm, and I blew it out the water. You know, some people may say, well, shucks, you better had, but I mean, you know, when it's something that you really, really struggle with, sometimes you really have to kind of go into it with a different mindset, you know, and I think for me, it was changing that mindset on that 4th time, because after the 2nd and 3rd time, you get so nervous because you're like, man, I failed it twice, or I failed it 3 times. What's going to make this one any different, right? So, like I say, anytime you go into something and failure is there, but you can't let it stop you from succeeding or pushing through your goal. And that's what I had to do, man. I had to push through my goal. And here I am today, you know, as a result of not giving up. You know, I could have let that stop me, but I didn't. So.
Yeah, what you had was persistence and resilience. That persistence is crucial. It's key to making it to the level that you are. Most people raise the women in their family. I'm not going to say most people, but a lot of people, they say, even in the movies, better marry you a lawyer or a doctor. And why do they say that? Which, I think the main reason we know why they say that is because you can probably count on having a stable lifestyle based off the salaries that those two professions are usually able to get. But another thing is, you're aligning yourself with someone who is persistent, who went through a very rigorous regimen and came out on the other side.
Right, exactly.
So when people call you doctor, all right, how about the people who knew you before you were Dr. Percell Sanders? Is there a difference on how they look at you, how they talk to you?
Man, nah, it's all the same. Man, nah.
Oh yeah,
people who know. If anything, people who knew me before, they still treat me almost exactly the same. I mean, even like I say, I don't know if people know you and our family, but we still have the same conversations before I graduated. And after I graduated, we have some of the same conversations. But I think it's good though, because for me it's humbling, right? Because I don't really see myself in a certain light or anything like that. Obviously, people who don't know me and they're introduced to me by my title, it's humbling because to me it shows me where I've come, how far I've come. And to be able to educate my family and my friends as much as possible, it's a really good thing, a good feeling. Of course, when it comes to family, man, and I'm the baby in my family. So when it comes to family, man, I think what they call it, baby syndrome or something like that, man. You're gonna always be the baby. So you're gonna always be the grandbaby. You're gonna always be the nephew or the little cousin or the little brother, and that's how they gonna see you. So I mean, as much as you say, "Hey, I know this. I studied this. I went to school for this." Blah 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 blah. They're gonna look at you, roll their eyes, and like, "Yeah, all right, Percell."
Oh yeah. Somebody told me, Percell. You know what we call you. Hey, somebody told me. I can't remember where I heard it from, but I've used it ever since. It's the wipe butt syndrome, the WIPE butt syndrome. Basically, right. Anybody who's ever wiped your butt or is old enough to have wiped your butt, they don't think you can tell them anything.
Oh yeah, man. It's so funny, man, because I get patients that are literally the same age, if not a little younger or a little older than my grandparents. And I talk to them, I educate them, they listen to me. But these same people, when it comes to my grandparents, and I try to tell them those same things, they'll shake their head, yeah. But then sometimes it's like they don't even listen. I was like, all right, well,
Man.
So it's interesting in that manner. But I guess when you've been living as long as our grandparents have been living, man, some things they kind of go in one ear, not the other, and you appreciate it for what it is.
Oh yeah, me and Granddaddy be going at it sometime because he's stuck in his ways, and I like to feel enlightened, right? But it's one of them things to where I guess they prove their theory, right? They're like, all right, I mean you at least a third of my age, half my age. I've proven what I do works. Right. You still trying to see if what you do works, so figure it out. But yeah, man. So all right, so boom, we covered how you got into chiropractic. We covered your bachelor's degree prior to chiropractic. and we talked about Life University. So how many chiropractic schools are there in the United States? And where do you believe Life University ranks on that totem pole?
So, not to sound too biased, because obviously I graduated from Life University, which I think is the best one in the nation. But there are, frankly, and I don't want to give you a wrong number, so I'll kind of shoot a range out there between about 15 and 18 chiropractic schools in the nation. Life University, honestly, it will probably rank within the top 5. If I'm being really honest, I would say number 1, but realistically, it probably will rank in the top 5. And the reason why is because Life is doing a lot of different things in terms of just innovation, chiropractic innovation, spreading chiropractic, across the world. They're actually just starting to open up a school in, I believe, London. So they're really trying to spread chiropractic and where, as far as the education is concerned, and opening up different satellite schools. So, I like to say Life University stands at number 1, but, everybody graduated from a different school, so they would probably say it's theirs, but, it really doesn't matter. I think ultimately the most important thing is if the school that you go to has a foundation and a good philosophy, of what chiropractic is, what it does, and what it stands for. And as long as you have that foundation at your school, then it doesn't matter where you go.
Okay, so you have someone who just graduated, and you might have to turn my volume down because I hear feedback. All right, so you have someone that just graduated. They're wanting to practice chiropractic in Florida. What can they look for to expect for these boards, and how do the boards work?
So in chiropractic, there are 4 boards. There's part 1 through part 4. Certain states require what we call a PT board or physiotherapy board, and that's of course the 5th board. But all states don't require it. So nationally, there's 4 required boards that you have to take. Part 1 through part 4. Since I graduated, they've actually changed up how they administer and how those particular boards are made up. When I was taking it, part 1 consisted of 6 subjects. Part 2 consisted of 6 subjects, and then part 3 and part 4 were mainly your case studies and your physical exams and things of that nature. So essentially, part 1 and 2 was all paper. You sit down, get a Scantron, you get paper, and answer hundreds of questions. And part 3 was questions also, but it was more case based. And part 4, there was really hardly no paper. It was mainly you and a mock patient, and you're essentially just showing what you know. How can you put together a case? How can you treat a case? Putting together a treatment plan and all of these things. So part 4 was definitely a lot more hands-on than any of the other previous 3. And then the PT exam is primarily made up of just PT, physiotherapy, modalities, like your E-stim, electrical stimulation, your ultrasound, therapeutic ultrasounds, stretching, all of the things that come when you go into a chiropractic office, all of those extra stuff outside of an actual adjustment, that's basically what the PT portion was about.
Got it. And I know there are many specialties and different niches, different things that a chiropractor can end up doing after they've graduated school, taken the boards, and gotten their feet wet. But starting out, say a chiropractor just standard, and we're going to just talk about Florida because I know depending on the state, it could be different. But starting out, first year, just a run-of-the-mill chiropractor, still learning. They just passed the boards. They still learning. What's a salary that they can expect? What's the standard salary first year?
First year out of school, that even for the state of Florida, I would say that would depend where you go, what type of office you're trying to do. Some people try to open up on their own, but if you're like going to associate with someone and you want to work under somebody to kind of learn, you can look from anywhere from 60 to 80, starting out. Of course, the more experience you have, then the more that can potentially raise. So for the state of Florida, it can range that first year, like I said, from anywhere from 60 to 80. If you're a great negotiator and you know what you can do and what you can't do, heck, it can probably start higher than that if you know what you're doing, or if you know how to negotiate well.
And then depending on what niche you get into or what specialty you get into, it skyrockets from there, potentially.
Oh yeah, absolutely.
Now, there's something that I've told you, and I want to also share it with all the other aspiring or current chiropractors. When you were in school, I was doing inbound sales from people all over the world. Well, not all over the world. Look at me. All over the United States. But anything in the United States, we like to call it the world. Like the baseball teams don't play nobody else in the world, but it's the World Series. And the football teams don't play nobody in the world, but it's the World Championships. They just playing people in the United States. But so I just got that American state of mind. But when I was taking calls, I would get calls from chiropractors sometimes because I was in insurance, inbound sales. And every once in a while, I would come across a chiropractor who, and I'm able to see all of this because I'm working on their policies. People who own all of their cars, they own their house. No leases, no car notes, no mortgages. Like I can see all of this, right? And whenever I came across a chiropractor that had that situation, which was approximately about 5 of them, I said, I have a cousin in school and he's looking to be a chiropractor. He's about to be. What advice can you give me to give him? Right? And then, of course, it was implied that you were going to be a good chiropractor, right?
Right.
But the advice that all 5 of them that owned all of their cars, that owned their houses, all of them said, buy a business that's already in existence. So the advice that I gave you from them is the advice that I give all other aspiring chiropractors. It's nothing wrong with doing a bootstrap, starting from the bottom. And like Dr. Percell just said, my cousin, like Dr. Percell cousin just said, you can come straight out of school and buy your own thing, like immediately. You can also learn from somebody before you buy your own thing. If I were to pick the best route, I would say learn from somebody and then buy your own thing. Or buy out the person that you learned from.
That's probably a good option. That's probably a better option.
Now, one of the reasons why that might work out for people is usually people start businesses to pass on to their children. Being that being a chiropractor requires you have this higher education and becoming a doctor. A lot of chiropractors aren't able to pass their business that they worked years on building, that brand, that goodwill. They're not able to pass it to their kids. Why? Because their kids aren't chiropractors. So they're looking for young, hungry, ambitious, up-and-coming chiropractors to teach them what they know and possibly sell them their business when the time comes. Because who else they're going to sell it to? They can't pass it to the kids. So that's something to consider. Man, thank you so much for coming on and letting me talk to you. Is there any last words you want to share with my audience?
So, if anybody is in the Jacksonville area, of course, that if you're in a car accident or anything, if you have neck pain, back pain, headaches, they can reach me at Dr. Sanders at nfmcjax.com, or you can reach me at Sanders, Sanders at gmail.com. Either way, you can contact me. We can set you up for an appointment and get you started right away.
Dr. Percell Sanders. And when you went down that list, I thought about something we didn't talk about: digestive issues. Man, a lot of people don't know, and things like IBS and chronic digestive issues have also been proven to be fixed by going to a chiropractor. And it's one of them things that you just wouldn't necessarily associate the two, but they are associated, and it can fix something that you've probably been dealing with for a majority of your life. Thank you so much for coming on, man. I appreciate you. And you told them how they can reach you. Definitely, if you've never been to a chiropractor and you're in the Jacksonville area, reach out to Dr. Percell Sanders. Appreciate it, man, and I hope you have a good day.
Oh, yeah, same here. Appreciate you.
Absolutely. That was Dr. Percell Sanders, board certified chiropractor in Jacksonville, Florida. And just to touch on what I was telling him about buying an existing business opposed to bootstrapping and starting everything from the bottom on up, which that is a very satisfying feeling of starting from nothing and turning it into something. But not just chiropractic industries, all industries, they have a type of purchases that people who might not be the best candidates for bank loans to do. But let's just use the chiropractic industry for example. Let's say you are a new chiropractor and you understand and appreciate the benefit of learning from someone who's doing what you want to do, someone who's doing it successfully at a high level. You get how that could benefit you to learn from them, learn from their past mistakes, get their advice, get their insight. You see that benefit. So let's say you do decide to do that. And like I said during the interview, most chiropractors and other people in specialized industries like chiropractic, even an attorney, can't pass down their business to their children, because in order for them to do what you're doing, they have to have their own schooling and board certifications. And maybe your child doesn't want to be a doctor. Maybe your child doesn't want to be an attorney. So you have to get creative. If you have somebody And I'm looking from the standpoint of the business owner, the one that already has a successful business. If you find somebody that you see is really ambitious, somebody that's willing to help you with your company, and they also have the same credentials and licenses as you, and you also know that you can't pass this business down, the actual business, to your children, but you still want some type of retirement, and you still want maybe some, if you can't pass the business, you can pass some money down to them. So this is a way that it could work. A lot of people do this to where they don't need a bank to buy a business. They align themselves with that business owner. And once again, it can be your child that you set up this arrangement with, if it's not one of those specialized industries like that where they have to have additional licenses and credentials. But what you do is you set the sale price, and this person that you vetted, this person that's helped you, you have an installment purchase agreement to where, and let's just make the numbers easy. Let's say you're selling your business for $100,000. And when I say your business, you're selling your website, the one that's already search engine optimized. You're selling your phone number, the phone number that's already been marketed for years, maybe even decades, that your existing customers already know. You're selling the equipment that the new young doctor may or may not need. And if you own the property, you're selling the real estate. So just imagine not having any money and not being what the bank considers a safe loan, and you're able to align yourself with somebody who has already built up something, and you set the sale price, and I'm just making this an easy number, for $100,000 plus interest. So over the next 10 years, the person that you sold your business to will be paying you that $10,000 plus interest. So let's just make it $1,000. So every year, the previous owner of the company is getting $11,000 a year, while the new young doctor is paying that as if it's a bank loan, but of course making their profit with the rest. So after 10 years, the old owner has now received $110,000, and the new doctor now owns that business flat out. Why is that important? Why market a new phone number when you already have a phone number that's been pumping for decades? Why try to get a new website built and try to learn search engine optimization when you've got a existing website that's been getting traffic for decades? Why buy new equipment? Well, you will have to buy some new equipment as technology advances, but why buy all of the basics? Why try to figure out where people are willing to come to visit your business when you already have a facility where it's already proven they come to easily? It's not a bad trip. No bank, no trouble. Well, at least not the typical startup troubles. So that's just something to think about. This is the Entreprenudist Podcast.
Gotta make another couple $100,000 a month. Know I can do it, I just gotta stay in the hunt. Grab some snacks and some fluids and a couple hands of blunts. I play through the fourth quarter, I don't play in the punt. Gotta make another couple $100,000 a month. Watch me know I can do it, I just gotta stay in the hunt. Grab some snacks and some fluids and a couple hands of blunts. I play through the fourth quarter, I don't play in the punt. Watch me son. If words to cut, I got lots of swords. I'm old school like a harpsichord. I'm no fool, I'm with the gods and lords. A cold brew that's quality hops, of course. Just for the crews that's tired of mopping the floors. You still with the carrots and sticks, all of the merits and tricks, the clock punches and free lunches when you're coming on Sundays. I'm sorry, my dudes, this song ain't for you. Just keep on working till you're eating angel food. I'll come home and crank on the news. This for the creeds with the LLCs, yeah. The board of directors that make the directors, yeah. The sole proprietors that pray for protection, and the ones with the solid business plans that's looking like cake to investors. You do a disservice when you wait for perfection. That picture doesn't exist, but doesn't dismiss. I insist as you miss it, you fix it, you get it. Wise words I once heard from a seasoned detective. Things a little different once you change your perspective. Look at me now, gotta make another couple $100,000 a month. Know I can do it, I just gotta stay in the hunt. Grab some snacks and some fluids and a couple hands of blunts. I play through the fourth quarter, I don't play in the punt. Watch the sun. Oh, yeah.
You've just been listening to the Entreprenudist Podcast, the place to hear real entrepreneurs and business owners bear it all. If you just arrived to the station, subscribe to the station.
Barely go to school, was too impatient with it. But they said I had to do it, all my fate was finished. Man, that's nothing, I started a company and take percentage. Now I got 40 acres in the mule with inflation.